Are you wondering why your legs are swollen? Put your feet up and listen. So I actually had a question from one of my viewers. They wanted to know why their mom's legs were so swollen and why they had caused her to start having fluid in her lungs. This viewer was wondering how this could have been prevented. Well, the answer is actually a little bit more complicated. So let's talk a little bit about edema. Yes. Edema. That's the fancy medical term for swelling. Let's talk about peripheral edema, which is swelling in the periphery of the body, usually the feet and the legs. There can be lots of different causes of swelling. It could be because there's an increase in the amount of volume and pressure, or the volume of blood in the body, for example, like during pregnancy. It could be because the vessels that are holding the blood are kind of leaky and some of the fluid leaks out. This is all in very simple terms. It could also be because there's a low protein level in the blood. Protein kind of sucks fluid into the blood vessels. So if somebody has a low protein level because they're not eating a lot of protein, or they're losing protein through their kidney or their gut or some other mechanism, then they get edema. It could also be because of a blockage of a vein or a lymphatic channel. The lymph is another type of fluid that we have in the body, and it can be blocked if there's compression or some kind of mass or something on one of the lymph nodes or lymph channels. Those two last things, a vein blockage or a lymphatic blockage, usually that causes swelling in just one side of the body or the other. The most common cause of leg swelling in older people is the veins being kind of, well, we call them incompetent. The veins carry blood which is going back to the heart from the rest of the body. And those veins have little valves in them. If the veins become sort of distended, or the valves aren't as snappy as they used to be, then there's going to be some venous stasis. And stasis just means that the blood and fluid that's in the veins just kind of sits there. It doesn't drain the way it's supposed to. And that causes edema. Venous stasis edema is usually something that comes on gradually. It's usually on both sides of the body, not just one. And it usually gets better after you've had your feet up for a while. So, for example, it might really be diminished in the morning after you've been lying down all night. If you have swollen ankles, it is important to check with your doctor that it isn't some other serious cause. Things you can do to reduce your ankle swelling might include reviewing your medications with your doctor or your pharmacist. Some medications can promote ankle swelling. For some people, taking in a lot of salt and fluid can also promote swelling of the ankles and legs. Wearing compression stockings and elevating the legs might be helpful. So let's go back to that question about why the leg swelling was causing the fluid in the lungs. And you know what? It might be the other way around. There's a condition called congestive heart failure, where the heart muscle isn't pumping as well as it should. The fluid that is supposed to be filling in the heart chamber kind of gets backed up into the lungs and the rest of the body. Again, that's a really simplistic explanation, but chances are if the heart was starting to fail, then that probably made the ankle swelling worse. So the most likely thing that happened was that the mom had some venous stasis, or sort of had some of those incompetent valves in the veins, and then developed a challenge with the heart on top of that. It's pretty common, and sometimes leg swelling can be a big challenge. But talking with your doctor and your other healthcare providers about what the cause is and working on some of those causes might be helpful. So I hope you learned a little bit about ED. Thanks for permitting me a pun. And if you want to know more about edema, check out our blog.